Having supplemental benefits as part of Medicare Advantage is huge because it allows for the intersection of social care and healthcare in a way that we haven't had, because prevention is not something that the health system has gotten down. It's really struggled to figure out how do we really address those root causes of the reasons why people ultimately end up in the hospital. And supplemental benefits allow for those different components to be addressed.
Medicare Advantage allows us to combine social care with healthcare. There's more to healthcare than just health programs.
Social care and medical care are so different. They're regulated in such different ways. They are reimbursed in such different ways, but there is now a bold move to really begin to pay for the critical social factors. Food is medicine, transportation, telehealth, social needs are crucial.
We really need to make sure that people understand that the supplemental is not really supplemental. It's actually really integral to our normal health and well-being. The term supplemental does imply that it is additional, not needed, can be without, but I don't think any of us would think that food is supplemental. Social support, having people that can monitor our well-being, I don't think any one of us would view that as being supplemental.
There are things like soup and cereal and other kinds of goods that can help people with some of their very basic needs. So if somebody's getting, let's say, like a $600 a year benefit, that's pretty meaningful for some people.
These supplemental benefits, whether it's nutrition or transportation or other things, they're tied directly to the outcomes of a better quality of life for those individuals who receive them. And we know the value of nutrition as a preventative tool from a number of chronic diseases.
When you think about the cost of providing a meal to a senior for every day of a year, it costs less than the cost of one day in a hospital.
There was a program in Massachusetts that offered 168 meals to people for a period of weeks, and they ended up with reduced inpatient and emergency department spending in the first year.
We talk about post-hospital discharge meals, but nowhere do we talk about, was malnutrition part of the reason why the individual ended up in the hospital in the first place. The reality is that all seniors need access to these services and these benefits. And so, if it has to start with Medicare Advantage, let's hope it starts there, but let's hope it doesn't end there, because the services that our programs provide, that we advocate on behalf of, are important across the senior population writ large in this country.